Philippines fighting COVID-19, contact tracing in communities. COVID-19 is an infectious disease caused by a new strain of coronavirus called SARS-CoV-2. It is spread primarily by direct contact between people through droplets produced by coughing, sneezing, or talking. These droplets containing the virus can also land on objects and surfaces around the person, such as tables, doorknobs, handrails, and cell phones. People can become infected by touching these objects or surfaces, then touching their eyes, nose, or mouth. COVID-19 is affecting millions of people all over the world, with more than hundreds and thousands of deaths. These figures are expected to increase unless effective public health measures are implemented. This instructional video presents the contact tracing process in COVID-19. What is contact tracing? What are the goals of contact tracing? Who are the key players in contact tracing? And what are the major steps and specific activities in contact tracing? One of the most important public health interventions to prevent the spread of COVID-19 is contact tracing. Contact tracing is the process of identifying persons who may have close contact with a person with COVID-19 and subsequent collection of further information about these close contacts. By detecting cases and identifying their close contacts, reporting them, isolating them, and treating those who have symptoms, public health aims to reduce transmission of infection in the population. The goals of contact tracing are to interrupt ongoing transmission and reduce spread of an infection, establish epidemiological link or track the sources of infection and contain further spread, alert contacts to the possibility of infection and ensure timely referral for management and care, provide diagnosis, health education, and psychosocial support and treatment to those who have COVID-19. Help prevent reinfection in a person previously treated of COVID-19. Learn about the epidemiology of COVID-19. The key player in contact tracing is the city or municipal health office and its city or municipal epidemiology and surveillance unit. Through the city or municipal health office, the local government unit will have a local epidemiology and surveillance unit, or LESU. The function of the LESU is to oversee and supervise the contact tracing and monitoring activities within their jurisdiction. The local government unit will also lead the case investigation and contact tracing and monitoring. The contact tracing and monitoring team is led by the city or municipal health officer with the city or municipal PNP chief as co-lead. The members of the team are city or municipal or rural health physicians, nurses or midwives, Barangay Health Emergency Response Team, Philippine National Police, and Bureau of Fire Protection as appointed by the DILG, and recruited volunteers. The contact tracing and monitoring team has the following functions. In terms of contact tracing, the team is responsible for conducting contact tracing by profiling and assessing close contacts, collecting laboratory samples as needed, conducting immediate transport of close contacts for health facility isolation, providing health education to close contacts and giving them instructions about what they need to do, and submitting accomplished forms to city or municipal health officer and the city or municipal epidemiology and surveillance unit. In terms of contact monitoring, the team is responsible for conducting daily monitoring of close contacts for 14 days, accomplishing recording forms and submit to health officer at the end of each day, facilitating transport for immediate referral of contacts who are symptomatic for appropriate assessment and management, providing health education and giving instructions about what close contacts need to do, referral to appropriate offices, non-health concerns or issues of close contacts, and submitting accomplished forms to local health office. Contact tracing involves 3 major steps. Identify cases, identify close contacts and venues and settings, and take immediate action. Identify cases. In case identification, persons with signs and symptoms of the disease are classified as suspect, probable, or confirmed cases depending on availability of test results. These persons are immediately isolated and treated. Contact tracing should start as soon as a person with COVID-19 or a person who may have COVID-19 is identified. Identify close contacts and venues and settings. All persons considered to have close contact with the individual with COVID-19 or those who may have COVID-19 should be listed and profiled. A close contact is an individual who was exposed to a person with COVID-19 from 2 days before the onset of symptoms until the patient has had a negative result in a repeat test. The World Health Organization also recommended to include as close contacts those A. Individuals who had direct contact with a person with COVID-19 for at least a 15-minute conversation within 1 meter from the patient, or B. who shared an enclosed space for a minimum of 2 hours with the patient. In contact tracing, we ask the person with COVID-19 or someone who may have COVID-19 about his or her activities and social gatherings attended, the settings and places visited, and those who have been in close contact with him or her from 2 days before the onset of symptoms until the patient had a negative result in a repeat test. The contact tracing and monitoring team will need to identify all the close contacts of the person with COVID-19. These close contacts are typically family members, close colleagues, office mates, health workers, or travel companions. The close contacts will be reported to the respective city or municipal health office. There may be instances when a close contact cannot be individually identifiable, or if there are specific events and venues where a case visited. In such instances, broad communication like media advisories can be released to facilitate contact identification and listing. As soon as close contacts are identified, the contact tracing and monitoring team will need to get in touch with them. These contacts will be interviewed to complete the close contact profile form. The close contact profile form asks about the contact's demographic profile, including name, age, sex, date of birth, home address, and contact details. It also asks about the contact's health profile, which includes known medical conditions, current medications, and blood type. The nature of exposure of the contact will also be asked. This includes travel information, accommodation, food establishments visited, stores visited, health facilities visited, events attended, and workplace. Symptoms, if there are any, will also be asked. This includes presence of fever or respiratory infections or diarrhea in the 14 days prior to first date of exposure or any time during or after date of exposure. If a health worker is identified as a close contact, the health worker exposure risk assessment tool will be used in addition to the close contact profile form. As soon as all contacts are interviewed, their details will be summarized using the contact line list form. Take immediate action. We immediately isolate suspect, probable, and confirmed cases in designated isolation centers for 14 days or until they turn out negative on repeat test. We monitor their condition and provide care as needed. We quarantine all close contacts without symptoms, ideally in community quarantine centers. We monitor their health condition and provide management and care as needed. All close contacts without symptoms will be monitored daily for 14 days for signs and symptoms of the disease. To document symptoms of close contacts, the contact tracing team will need to use the contact tracing signs and symptoms log form. Close contacts without symptoms can be referred to temporary treatment and monitoring facilities, or TTMF, or megaligtas, COVID centers which are being established by converting facilities such as Philippine International Convention Center, or PICC, World Trade Center, Rizal Memorial Sports Complex, Quezon Institute, Food Terminal Incorporated, or FTI, Phil Sports Arena, Ultra, Philinvest Tent, Duty Free Philippines, Amoranto Stadium. There may be instances when a close contact cannot be individually identifiable, or if there are specific events and venues where a case visited. We advise the public to avoid these places, settings, and venues. We also advise those who were in the same event or place as a confirmed case to self-monitor and contact their local health authorities if signs and symptoms appear. Close contacts and people who are in the same events or venues will also be provided with information about the disease and how they could avoid transmission to others. In all the steps of contact tracing, it is important to ensure confidentiality and privacy of information gathered from patients and close contacts. Effective communication and provision of psychosocial support are vital in achieving the goals of contact tracing, while at the same time ensuring that trust and rapport are built and the needs of patients and close contacts are addressed. Contact tracing is an extensive process that requires different agencies working together to quickly identify potential cases and limit further transmission of the disease. It also requires cooperation from the public for patients to be given proper medical attention and to prevent further spread of COVID-19 in communities. Missing even just one case from close contacts will allow transmission of the disease to others, resulting to more cases and lives lost. Let's stop COVID-19 transmission now. Detect, report, isolate, treat. It is our most urgent action today.